Welcome to our studio. You don't want to know how embarrassingly long this took to set up, despite what it looks like. We've got 2 golden retrievers outside this door here. We tried to have them in here, and
It was chaos.
yeah, it was. Chino was on, my dog was on that seat, and I was like, oh, this could be cute. Next minute, the other golden retriever that is larger was
trying to get in on
just,
the
you know how they've
action.
got that tail of destruction?
Yeah.
It was just all a lot. It was a lot. Anyway, we do have plans, everybody, to get ourselves into a much more fancy professional studio. At the moment, we're just in my office because gal's got to do what a gal's got to do. But that's all right. It's all part of the fun, right?
That's right. We're baby YouTubers, and we'll look back on this and laugh, even though we're laughing now. But
remember that time?
yeah.
Yeah, I haven't even changed my walking the dog shirt, but that's okay.
Come as you are, friends. There's no
Just
false...
don't smell too close this way, because I'm not sure if when you want to know, actually, this is a question for you and also for everyone listening. Oh my gosh, this is so funny. Do you, if you aren't sure if it's you that smells or not, let's say you've, I don't know, been sweaty or whatever, and you're like, something smells. Do you, what's your strategy? Do you, do the look down to, your armpit and just, do a subtle smell? Do you do the, lift up your arm and just go for it, nuzzle your nose into your armpit? Or do you do the finger swipe under the armpit and then a quick sniff under the nose and back down? What's your strategy?
The last one.
Yeah. But don't you reckon it's the grossest one?
Yes.
I've just put my fingers under my arm and now I'm smelling them.
Yeah.
Why do we think that that's more acceptable than just sniffing?
Look,
we've now involved an extra body part that didn't need to be involved.
So my thought process is I want to know for sure if it's me, and then I'll go and do something about it. Or if it's not, and I can not worry about me being the one that pongs. And it's if I was just to go
and look down at you.
Yeah, I'd be like, isn't it? I want to know 100% sure.
Yeah,
so that's all right.
It's just, I often, when I do it, I'm like, because I'm such a people watcher, right? So I'd notice if someone did that.
Okay.
But for some reason, I don't think other people would notice if I, in my head, I'm like, no one would know. I'm so cool.
No, because you just kind of pretend you're scratching yourself.
Yeah.
And then...
yeah.
Couldn't you?
No. Let's run a social experiment.
Shall we? Okay.
Yeah.
Next time
Let's
we're
just
out.
go and sit at a cafe for I don't know, an hour, and every so often do it and just clock whether or not anyone watches.
All right, we'll report back.
Yeah. Anyway, completely unrelated material.
Yeah.
This episode actually is something that a lot of people have actually requested. So obviously, it's not going to be relevant to every single human. If you're not pregnant or you're not involved in the care or support of pregnant women, then perhaps, you're not even clicked on this episode. So well done. But if you are, we're going to assume that it's relevant to you. And the first thing I just want to say, because I don't know what kinds of trouble you can get yourself into when you're sharing this information, but this is not medical advice. This is general education and sharing from our own personal clinical experience around options to inform you. But at the end of the day, personalised care is always going to be best. So whoever is your healthcare practitioner, discuss that with them. But that aside, the oral glucose tolerance test is something that in the context of Australia, and I'm sure it is similar overseas, but just for simplicity's sake, it is something that is recommended that women do in pregnancy around week 26 or so, 26 to 28 or so. It's not mandatory, as in you can refuse, like many things in pregnancy. You can say that you don't want to do it, but it is something that is commonly done. And for a lot of our clients, and maybe you listening as well, if you're into more natural holistic health or you're someone that maybe questions the necessity of certain interventions, we have a lot of our clients who are like, well, I don't really want to do that. I don't want to drink that big lot of sugar glucose in one go. And fair enough. And there are other options, but it's just about knowing what those are. So maybe where's a good place to start, just with some context?
Maybe let's start with first of all, why you might consider other ways of assessing yourself for gestational diabetes. That's the point of it.
Mm.
There are risk factors that might increase your chances of gestational diabetes, that might influence which way you want to go. Of course, there are also risks of developing gestational diabetes for the mum and the baby. And so I personally and professionally think you should be keeping an eye on your blood sugar, insulin, and food quality, regardless of this test and whether you do it or not. But what I will say, like we would tell our clients, it's not black and white about whether something's a right fit or not. It's always very much what's your history, like any prior pregnancies, things like that. Do you have other risk factors that might increase your chances? But across the board, to me, healthy prenatal care does include making sure your blood sugar and insulin is balanced. I don't think waiting till like 24, 26 weeks is really that great standard of care, to be honest, to be checking. But of course, at this point, things can really start to escalate, which is probably why the timing is what it is. But let's discuss, I guess, some of the concerns around it. So, if you are listening to our podcast, you are almost certainly interested in being proactive, making healthier choices. You probably don't have a lot of sugar in your diet anyway. Bearing in mind, gestational diabetes is not just a blood sugar thing. This can be a placental thing, an immune thing. So, just kind of clearing that up. But you probably don't put a bolus dose of sugar into your body ever, and probably haven't done for a long time. And so to do something that actually we know is harmful to the body and doesn't align with our health values and choices at the time means we might want to explore other options. Now, first of all, the standard drink that's given is just a bolus dose of sugar, but it's not just that. So that in itself is problematic as a method with which to assess gestational diabetes. I think there are better ways, which we will talk about, but that's its intention. But the actual drink itself has chemical food dyes, additives, modified food starch, which last time I checked could not be guaranteed gluten-free, brominated vegetable oil, which, side note, has been banned in Europe and Japan, and dextrose, of course, GMO, genetically modified corn sugar. Things that I personally wouldn't put in my body even if I wasn't pregnant, but I sure wouldn't be exposing my unborn child to that either. So, there's a few other elements of this test that I also think could be better. But if we were going to do a like for like swap and apply this in the traditional manner, the way it's currently recommended in the allopathic medical system, first of all, as Nat said, you can decline anything. There's like literally nothing mandatory in pregnancy, but also you want to make sure if you do that, you're doing that with very good reason and you're also monitoring blood sugar some other way. But let's say you opt for this test, you could then opt to use orange juice instead. Same amount gram for gram of sugar, but without all of those other additives. There are other, like I've seen midwives recommend using an equivalent amount of dates or an equivalent amount of gummy bears, obviously not the sugar-free ones because that wouldn't have the same
You
effect.
just shit yourself.
That's right, been there, done that. But I personally think if you were going to try and recreate that, orange juice is going to give you the most similar effect. Those other two things are going to break down a little bit slower. The second thing, though, that I would also suggest is there's no guidance around this having to be done fasted. And I have also seen midwives coach my prenatal clients to increase their carbohydrate intake for a few days leading up to it and have a really good breakfast beforehand, because you can get false positives if you go and fasted and then drink a bolus dose of sugar, of course your blood sugar is going to look wild and silly. I know mine is because I'm quite sensitive, and give you a result that doesn't necessarily reflect your risk in any way. Now, I think it's concerning that the test, first of all, the quality of the drink is so poor, and that, you know, in the profession, it's understood there are false positives, and there's this pre-test coaching going on to try and reduce the risk of false positives. All of that to me feels like a red flag. And so there are other things you could consider doing. Obviously, discuss this with your midwife or your fertility specialist. But if I was pregnant, these are the things that I would consider doing. So you got a couple of
Mm,
options for our
yeah.
friends, don't you?
That was interesting. Actually, I definitely have heard the increase your carbohydrates and recommend that to some of my clients in the lead up. But
Mm.
I hadn't heard the tip being given out of like
Mm.
have something to eat. But would you then say I'm just playing devil's advocate here.
Mm.
If you did that, would you then need to lie and say
Mm.
that you are fasted when you go in and do the test? Otherwise, would they not then just turn you away? Like, you know how if you
Mm.
go and do a blood test and on the form it says you need to be fasting because the doctor's written that on the form, and
Mm.
often the pathologist will say, "Are you fasting?" And if you say no
Mhm.
and the form says you're supposed to be fasting, people get sent away. So I'm wondering if
Interesting.
that I'm only saying that because if someone goes to the effort of doing that, then
Yeah.
I don't know, maybe that's something to
Mm.
experiment with. But yeah, I think in terms of other tips that I give my clients, so I would say that something that you can also make sure you do is avoid going after a night of or a morning. Like if you've had a bad night's sleep, don't go and do it the next
Mm.
morning. Your blood glucose is often less stable when you've had a really poor night's sleep. Like same deal if you've had a really stressful morning or you're feeling like really out of sorts, or if you're actively unwell, because all of those situations are going to negatively impact your blood glucose. And because they're all quite situational, assuming that you don't always have terrible sleep and you don't always feel completely overly stressed and you're not always sick, then you're not getting an accurate reflection of your normal. Now, if you are someone who is always stressed, then I would still go if I was stressed because that's still a reflection of your normal. So I do think that that's important just to be aware of. Now, if you decide, nope, I don't want to do either the drink that is given or I don't want to do the alternatives that we've just shared, the other strategies that I suggest for my clients is doing a combination of a fasting glucose and a fasting insulin without having any sugar or anything before it, just doing those as a standalone blood test, as well as pairing that with either 1 to 2 weeks of finger prick blood testing using a glucometer, which is one of those devices where you prick your finger, you do it as a fasting reading in the morning, and then I usually get clients to do it 1 to 2 hours after each meal, ideally for 1 to 2 weeks, so that we can really get a good idea of what is your own individual response to the foods that you're eating on a day-to-day basis. The other thing you can do is, which is a newer thing available relative to the finger prick testing, is you can wear a continuous blood glucose monitor, which is the one that just sticks in the back of your arm, and and you can basically, it's a little bit less labor intensive, I guess.
Mm.
Now, there are some discrepancies between the finger prick testing and the CGM because they're taking the sample of glucose from a slightly different cellular space. So you may be met with a bit of like pushback in terms of from a traditional midwife or a doctor saying like, oh, that's not as accurate. But I would argue that is as long as you're consistent with what you're doing, and if there are any concerns, you can always use another method on top of like the CGM to confirm or deny what's going on. But I think the CGM for some people, if they find the pricking your finger too intimidating, too labor intensive, it can be a good option. But otherwise, if you're fine to just do the finger prick testing, I think that that's a really good option. One of the reasons why I personally really like that way of measuring or assessing blood glucose is because it is like more than one data point in time. Any of us can have shit blood glucose at one point in time for various different reasons. B, it's more likely going to be an accurate reflection of, on average, what are you eating rather than something that you're potentially not used to putting in your system. And although in theory, in an ideal world, our body would be able to adapt to a spike in blood glucose and not overshoot the mark, or it would have a little bit more metabolic flexibility, so the ability to deal with different amounts of macronutrients. I also think at the end of the day, if during pregnancy you're eating a certain way and your blood sugar is responding to that really well, then you don't fit the criteria of having like an issue with your blood glucose management, and therefore can't possibly fit the criteria of having gestational diabetes. And the harm to the baby, or part of the harm to the baby in gestational diabetes, is having frequent spikes in blood glucose. And if you're not seeing that, then you don't need to worry. So they're the few options that I often suggest to clients. And I do say to people, if you do the monitoring of your own, like on your own, make sure that you do have a professional look over it so they can see. And also try and keep a bit of definitely keep a food diary alongside it, and also keep a bit of a stress and sleep diary, because I mean, I can think of even 3 clients just straight off the top of my head where they mostly had really stable blood glucose, but they had a few patterns emerge where we're like, oh, that's right on the edge. But it was quite clear that it was right on the edge, and there was a very good reason for it, that we could then use that data and go, okay, great. So we know that, when you have, I don't know, a higher carb meal and you haven't had as much protein as is appropriate for your body, that tends to happen for you. But at these other meals where you've eaten this different way, it hasn't. Or, there's ways that not only can that process of monitoring rule in or out gestational diabetes in perhaps more of a comfortable way for you, it also can give you feedback on how you could optimize your blood glucose regardless, which not only is a positive thing for the pregnancy and for the baby, but also for you, because it feels really shit to have mismanaged blood glucose, as in, if you're struggling with pregnancy nausea still, if you're fatigued, if you're brain foggy, having, mismanaged blood glucose is only going to add to that. So if you can even use it as an exercise in, well, how is there any ways I can biohack this to make myself feel any better? Sometimes that can just be another tool that's in your toolkit that's within your control. And that can be nice when so much of pregnancy is not in your control.
I agree. And I think also getting ahead of it. So I think it's good practice for everybody to be mindful of this. But when I think about risk factors in your family or in your own history, hyperinsulinemia, PCOS, type 2 diabetes, reactive hypoglycemia, maybe you've had a period of illness where you lost a lot of muscle mass, so maybe your insulin sensitivity isn't that great. Maybe your life is really high pressure and stress, or maybe you are having interrupted sleep. For example, you already have a child and this is like baby number 2 or baby number 3. All of these things would push you closer to having potentially more challenging time for managing blood sugar and insulin. And of course, preconception wise, it's always nice to get across those things. In the first trimester, you're basically in survival mode, so I wouldn't stress about that too much. But once you pop out the other side, rather than waiting to 26 weeks or whenever it's 28 when it's suggested to you, maybe actually running that experiment yourself with a CGM and your food. I know for clients, some of my clients, their midwives get them to wear the CGM for 2 weeks and just take photos of their meals. And
Mm.
then they look back on that data. And I think it's really clever to also include the sleep and the stress so you can see if there's an anomaly, if there was actually a reason why, and see where you can manage that. This is also really helpful, again, if you aren't sleeping well or you are high stress and this is affecting your blood sugar quite frequently, you can get onto that earlier. You can start to implement strategies then to support you and the unborn child. So, information's power. I think being proactive and preventative is always a great idea. And certainly, if you are low risk, it's worth discussing these other options with your midwife or fertility specialist. And I don't think there's anything wrong with, especially if you get onto this prior to that milestone, doing a CGM, doing those things, and actually demonstrating your blood sugar balance is great. That will allow you well ahead of time to have that conversation and say, well, I'm not having any issues with my blood sugar and insulin. What role does this play? Like is it just going to tell us my body doesn't like a huge amount of sugar in one go? Well, what body
Mm.
does? So I think knowledge is power. And like Nat said, we're not telling you what to do. You're the boss of your own body, but we are sharing with you the options that you can discuss with your healthcare provider so that you can make the right decision for you and your baby.
Yeah. And I just want to say, like, also for anyone who has opted to get the traditional glucose drink, you know, your body's very resilient. Like
Yeah.
you can survive. You're gonna be fine. Your
Yeah.
baby's gonna be fine. But we just are mindful that we have a lot of people who want to know what the alternatives are. So no, like please don't panic if you're like listening to this and you're like, literally just had the test or whatnot, because I do think that it's what we do most of the time that makes most of the difference, and you're not drinking that thing 24/7.
Mm.
But it's good to know that there are alternate ways, because I don't think that that's the message that women are always sent. I think the message is you've got to do this. This is the only way. If you don't, then you're harming your baby. And
Mm.
that's actually really untrue. And also, as Amie said at the beginning, gestational diabetes can also happen for other reasons outside of just your dietary habits, while that's a massive contributor. So just thinking of those of you who perhaps have like tried their absolute best with their diet and still are having some difficulty managing things, perhaps we'll do an episode on gestational diabetes management at a future date. But I just wanted to call that out in case someone's sitting there feeling that. I know it can feel really unfair when you're doing all of the right things and it doesn't feel like it's going your way, no matter what the health issue is. But yeah, just please share this episode with any of the pregnant women in your life who have invited in extra information. We don't love unsolicited advice. And yeah, keep it up your sleeve if you are planning to become pregnant in 2026 or beyond.
And on that note, Nat and I do really love caring for women in their preconception and prenatal journey. So reach out to either one of us if you're looking for support. I know Nat's got an amazing preconception guide, and I also am creating something special this year for women who are looking for a more holistic approach to pregnancy. So I'll pop a little link in there for anyone who's interested in getting more information about that. And whatever you decide to do, as long as you're feeling informed and empowered, that's all we care about. And we wish you the best pregnancy and healthiest baby ever.
Thanks for being in the studio with us, Fred.
Tune in next time.
Bye.
Bye.